Welcome everybody to our webinar focused on parent and caregiver voices and the why and how do we design an advisory cabinet. I'm going to give folks another few seconds to continue to join us this afternoon. I want to thank you in advance for being with us. Once again, thanks for joining us. I love that people are starting to put their names in the chat. Feel free to put your name and where you're coming from. I love seeing everybody coming from all of these great places. Thanks so much. Once again, I just want to welcome you all from to our webinar, really focusing on the details of our how we designed a parent and caregiver advisory council and what that looks like. So excited that you are here with us. If you're just joining, feel free to put your name and where you're coming from in the chat. We love to see who is here and all of the places around from all over. Great to see you here. Thanks so much. We are offering Spanish interpretation during today's webinar. So before we start, I would love to just have the opportunity to introduce you to our interpreter, B. Torres. I'm going to turn it over now to B to give you detailed instructions. B.
Thank you so much, Erin. Good afternoon, everybody. My name is B. Torres. My pronouns are she, her, ella. I will be your Spanish interpreter with the Community Language Cooperative, or the CLC. And I want to thank you for your commitment to language justice, which means that everyone should be able to listen in and participate in the language of their heart. To achieve this, we'll be using Zoom's simultaneous interpretation function. And in a moment, we will activate that and you will see a globe at the bottom of your Zoom screen. When you see that globe, you can click on it and select either English or Spanish as the language of your heart. Please remember to speak at a conversational pace so that I'm able to provide an accurate rendition of your message. I'll repeat this in Spanish and then we can get started. Hola, buenas tardes a todos y todas. Mi nombre es Vitorres, mi pronombre es ella, y yo seré su intérprete con la CLC o la Community Language Co-op, y les agradezco su compromiso con la justicia del lenguaje, lo cual significa que todos tenemos el derecho de hablar en el idioma de nuestro corazón. En un momento se activará la función de interpretación simultánea en Zoom y aparecerá un globo terráqueo en la parte inferior de su pantalla. Favor de hacer clic en ese icono y elija inglés o español como el idioma de su corazón. Muchísimas gracias. Ya podemos comenzar. Thank you very much. We can go ahead and activate interpretation now.
Gracias, B. Okay. Well, thank you again for joining. I am joined by two of my partners in peace here, both Dahi Wolf from Kids Forward, as well as Naila Adama. We are thrilled to have you. You're going to hear more from both Dahi and Naila as we continue throughout our conversation today. My name is Erin Arango Escalante, and I am so excited to be here with my colleagues in Wisconsin. And with this, we're going to get started and just share a little bit more about work that is happening. So on the next slide, I want to just start by talking a little bit about BUILD. I'm pretty sure folks are familiar with BUILD, but it is the BUILD initiative is a national organization that is truly advancing the work on behalf of our young children, and from prenatal to age 5, their families, and the communities in which they belong. BUILD is partnering with state leaders, including in Wisconsin, to promote equitable, high-quality child and family serving systems that result in young children thriving and learning. And like many of you, I know so many states have worked with BUILD. Wisconsin worked with BUILD as well on issues that have impacted young children, their families, and the communities. And in fact, BUILD has supported Wisconsin in the solutions that we're going to talk about today that have had such a direct and positive impact on our children and families. So the story that you're going to hear this afternoon is both important to BUILD and to Wisconsin, and to, I hope, many of you as well. We're really focusing on collaboration that started with BUILD, with our state agencies in Wisconsin, and the advocates as well. And we're going to talk about centering parents, of course. And all of those folks that supported this strategy. You're going to learn today about this particular strategy of centering our parents and caregivers, as well as the opportunity to learn about other strategies in future webinars, which we'll talk about at the end. This story that you're going to hear about today really highlights multiple funding sources, one of which is the Preschool Development Grant. And in fact, Build was able to analyze a lot of the preschool development grant applications and found this topic of family engagement to be of great interest to states. So we're going to drop the link to that particular brief highlighting this work that states are engaged in, those that received the Preschool Development Grant funding. So at this time, I'm going to turn it over to Dahi to really kick us off. And again, I want to thank you all for being here. Thank you.
Thanks so much, Erin, for getting us started and giving us an overview. My name's Dahi Wolf, he, him pronouns. I'm in Madison, Wisconsin at Kids Forward. Kids Forward is actually the oldest child and family advocacy organization in the United States. Started back in 1881, and we're an anti-racist policy center that works on multiple issues, including early childhood education. And then you're going to also hear from my colleague Naila, and I'll let her introduce herself when I pass it over to her. We're going to talk about, what we did. And I love the fact that I think this was probably Erin's idea, that we talk about the hows and the whys. I'm sorry, the whys and the hows, and the hows and the whys. And I think that that's like how we just think about, doing stuff. And I really feel like that the most important thing is the why, because you can't get, no matter what you do, if you didn't think about the whys and who's missing and what's going to happen before you do use the tools and do the hows, then I think it's for naught. So I'm just going to say I like the way we frame this as the whys and the hows. So we're going to start out with the why, and I'm going to let Naila jump in a minute and add to this, but I think all of us here have experienced people being left out, policies being made without input from the families and the caregivers and the parents that actually are going to be the ones affected by them. And of course, this has gone on for decades. And I think that we also all agree that that needs to change, and that I think we've all seen some examples of changes that are reframing that and actually centering the lived expertise of community members, families, parents, caregivers, etc. So we talked a little bit about last week about, who was missing in this process. So the problem that we're starting with, the history, is that, educators and parents and Black and brown individuals were not included in the discussions, in the decisions, at the table, having the power and creating the policies. And then when they did not necessarily, weren't necessarily successful, then, there was just like, well, but we use the experts, we know this is what's people needed. And in fact, that wasn't the case, or maybe the policies only worked for some populations and not for, those furthest from opportunity or most marginalized in our society. So I think, we're really clear that we know what has happened in the past and what the problem is. And so I think the beginning of the why is, well, we don't want to keep doing the same thing over and over again that doesn't work. And we actually care about that lived expertise and those families. And if we actually do, we want to build policies that work for them. And I think that what that really starts with, and I think Naila says this over and over again, is it's about, these programs and policies didn't match the needs of the families because we didn't ask the right questions. I'll say that again. We didn't ask the right questions from the right people because we didn't have the right people to ask the right questions. So I'm going to pass it over to Naila, and can you just kind of talk a little bit more about, that experience and why it's so important to, number one, ask the right questions, and number two, have the right people at the table.
Absolutely. Thank you, Dahi. Again, my name is Naila Adama. I'm here in Beloit, Wisconsin, pronoun she, her. And when we talk about having the right people in the room to ask the right questions of, I think it's also very important to remember that we need to be asking, and I love this about the work that we've done together, are we even asking the right questions? A lot of the times in this work, people of color, educators, parents, they're asked to give feedback on people's ideas that are already had and how to make those ideas work when maybe there's a better idea if you just present them with the problem in the first place. And that way you can actually have solutions that work for the people who are involved in those problems. I don't remember who said it, but I heard it in another group that I've been a part of. The people who are facing the problems are usually the ones with the best solutions because they probably navigated those systems a million times and they figured out the ways to do it. It's our job as people who can help, people in positions of power, to make sure that they have the resources to implement those solutions rather than giving them solutions and saying, hey, how's this working out for you on the back end? So I just really, I just want to emphasize that getting the right people in the right room, asking the right questions, and then asking the right people, are those the right questions, is key. And that's what, when we talk about centering lived experience, that's what that means.
Totally.
Not just getting people who have those experiences in the room.
Yeah, and you're a great example of that. And I love that you keep making that point. That's a great quote. I just want to say we've been shifting over the last couple of years from talking not just about lived experience and those voices, but actually naming it as lived expertise. And, we all talk about the fact that how important language is, because language represents power, represents, relationships, and, really defines what happens in the room and how things work. So I'll just say two quick things about that. One is that idea of, and I encourage all of you to do this if you're comfortable with it, is to, really just start talking about lived expertise, not just experience, but these are the experts, just like somebody, who's been at a state agency for 20 years or who has a PhD or, all those things. We know that value is really needs to be respected and, really valued. And the second thing is that you might notice when we talk about the advisory group that we started 3 years ago, that we intentionally and purposefully didn't just call it a council, or a work group, or any of those kind of, or a coalition. Those are all great things. We called it a cabinet, and that was very intentional because a cabinet is a word that has power and says, wow, this is a group that's on par, with a chief executive officer of a state or a country or wherever it is, and their cabinet, their trusted advisors. And so just want to say that those two issues of word choice were not accidental. And I think that leads me to say one more thing, which is that any of this work, these whys, these hows, there has to be intentionality, there has to be co-design, there has to be thoughtfulness about it. It can't just be, as Naila said, that folks show up and there's already a plan and they're just asked to, give feedback and then they leave and that's it. Naila, I'm going to show the video, but I'm just wondering if you have, or Erin, either of you, if you have anything more to add about the whys before we listen to some of those folks with that lived expertise.
Later in the webinar, I made some notes for myself for things I did not want to forget, and that intentionality is super important. So if I don't come back to it because I'm running my mouth about UBI, please remind me to do that.
I will definitely try to remember that. Erin, you have anything to add?
Yeah, I think the the other piece to add that I think is just such an important concept is of course, with everything else that you mentioned, is the inside outside way of doing work inside government and outside government. And we'll talk about that a little bit more as well. But I see so many partners on this call that are from both inside government and outside, and working together while centering our family voice has been critical. So we'll talk more about that later. But thanks. Let's watch this video. It's a great one.
I'm a teacher here in Beloit. I've been in Beloit almost 20 years now. Well, more than 20 years. I just got my 20-year recognition for teaching in the district. Got involved with community. I've always been really passionate about community advocacy and social justice. And this opportunity came up through my district. An all-call email went out about joining this group. And when I saw it, I thought I'm going to try to get in, because I thought for sure it was just another one of those check the boxes so that you can say you asked. Very pleasantly surprised that that is exactly what it was not. But my sole purpose of joining initially was so that I could be the thorn in their sides. Like, they were not going to get away with just having people check boxes and saying, oh, we did ask them. Stayed because, again, it was absolutely the exact opposite. Had been part of many coalitions, and it always felt like we were doing a lot of complaining and not doing a lot. And it always felt like we were tokenized as parents, as African Americans, as like whatever group that they were trying to get feedback from. It didn't feel authentic. Was blown away by the way that they made sure that our voices were centered and heard.
The child care provider that my children attended asked about interest in it. So that's how I initially found out about it. At the same time, I was on a statewide board for city planners that was working on childcare issues as infrastructure. So that's kind of how the two issues kind of tied together.
I actually found like a little ad in my kids' school newsletter saying that they're looking for people, and I noticed Madison wasn't on there, but I applied because I felt it was important. I'm a mother of 7, so I have 7 kids. And I've lived in poverty for most of my life, struggling to like figure out how to provide for me and my children. And so it meant a lot, because I not only was I a person who used the system, but I also was a child care provider at one point. And there was things I wish that, you know, other folks had access to or knew about. And so I knew that every voice wasn't being heard by the policies that were being made. So I was really interested in joining so that I can share my voice about how I felt about the childcare policies that are being made for the people who use it.
Understood real quick that I wanted to be a part of this network that helps communicate and bring the word of mouth, especially in my community in particular. Word of mouth is really valuable. So we're not very prone, and I don't want to generalize, but we're not very prone to like trust like internet sites or what an organization tell me, but I'd rather go and ask a friend or a neighbor or someone what their experience was in order to build that trust to then tap into those services. So I think I understood really quickly that. And one thing that I saw that was a little bit lacking in the community is like the resources were there, the funding was there, the people wanting to help was there, but the trust wasn't there just yet. So I think in a way I wanted to help be kind of like a bridge for that, sort of bring back that information to my community, help them understand the information well, so they could also spread the word with their own networks and just help in that manner.
All right, well, you got to hear from some of those folks with lived expertise that were part of this process, and we're very grateful to them for everything they've done over the last 3 years, and especially for being willing to be interviewed so that you could hear their voices and their ideas and their expertise. So the next thing we're going to talk about is, okay, we have the problem, we have the why. What's next? Well, the opportunity and hopefully the solution. And this was from a state level perspective, because our state Department of Children and Families, acknowledged all the stuff we were talking about earlier in terms of not having those voices, and really wanted to create a diverse group around the state that was going to be able to get together, build trust, come up with ideas and, really communicate directly to the policymakers about what could make things better. And as Naila says, asking the right questions to the right people. So in addition to calling this a cabinet, and I said that was very intentional because it's a powerful word, we also thought a lot about who we wanted to be there and what we would call that. And we ended up coming up with the idea of it being a parent / caregiver. And what that meant is we wanted to define this group as actually separate from the childcare workforce, from the folks in the ECE community who already had associations and support and conferences and professional development and and other ways to, at least at some level, have their voices and their expertise heard. And I think we particularly thought about the fact that if we had a table that included both professional educators from the ECE community and parents like the ones you just heard, Joyce or Drew or Naila or Rosie, that they might feel intimidated and might feel like that the professionals would have a more powerful voice and they might be less likely to, to speak up and to share and to really have their expertise heard. What's really neat about this project, and I think everything that we do, and Erin really got at this in two ways already, which is that none of this could happen without collaboration. And Erin mentioned two ways of collaboration that happen. And one was this idea of braided funding, multiple sources, to support this that couldn't have ever happened without that. And second, Erin brought up the idea of the inside outside, that, this wouldn't work if we didn't have representation from the nonprofit sector and representation from the state agencies. And I'm going to mention a third level of collaboration, which is that this webinar series is a collaboration between Kids Forward and All Children Thrive, who you're hearing from today, and also from Dr. Toshiba Adams and Senfoca Consulting, and WICA, which is our Wisconsin Early Child Association, which is the NACI affiliate for Wisconsin that represents childcare providers. So if you can come in a couple of weeks, I think it's August 14th, there will be an entire webinar on doing the same work with Black and Brown early childhood educators. And so I just want to point out that this is, I really just love the fact that there's this sort of synergy in all these collaborations to make this work. So that's how we defined parents and caregivers, and a little bit about why we made that decision. Now, the second thing about this process is, well, how are we going to select the communities? We can't have all 72 counties represented. We can't have, we talked about different sizes, and I think everybody said anything above about 10 or 12 people in a group, and then it's not as functional. So we ended up choosing 8 members from 5 different communities. And I want to tell you a little bit about how we did it, because I think that was something that was very successful and that I would encourage other communities to do. So Jonathan, we're actually back one slide, the one that, yeah, that one. Can you just keep it on that one for now? Sorry. So we used various different indexes of, to look at the demographics around our state. We knew we wanted rural and urban. We wanted people that spoke English and people that spoke Spanish. We wanted to just represent different communities. So we started, and this was with guidance from Build. Thank you, Bill. We looked at the Social Vulnerability Index. We looked at the county health rankings, which are actually done here at the University of Wisconsin in Madison, the ALICE data, childcare deserts, and others, to come up with the priority communities where we ended up doing our recruitment and drawing from in this process. So we'll be happy to share those in the summary, so that if you want to think about if you're doing something like this in your state or your community, how you would do it. So I'll just briefly go over this slide. It just kind of demonstrates what we were talking about here. We had the priority communities, and then we have the family members and the caregivers with those expertise, those diverse perspectives, and that lived experiences. And that's who we wanted at the table. So the next thing, and then I'm gonna in a little bit bring in Naila and Erin as well, is that, so how did we do this? And because we said it's the why, we're done with the whys, we're going to do more of the how. How did we select? We used data. And then we recruited. And then what happened next? Selecting members, we used a questionnaire, kind of an interview, and then a one-on-one interview process to really get folks that we felt like would be, great contributors to this. And I can't emphasize enough the next step, which is that you can't rush any of this work and you can't expect it to happen overnight. It has to be intentional. And as they say, moving at the speed of trust. That's already come up. And the fact is that we did a lot of relationship building and just getting to know each other. Most of it was virtual, but fortunately we were able once a year to have a retreat where we could all come together in person. And I know that every single person on the cabinet just felt like that was really significant to have that. So, Naila, do you want to add anything right now about kind of how it felt to be part of this group and to meet all these folks?
Yes, and I'm going to just touch briefly on that part where that trust building, because I know we're going to get into some more, because that is such a huge component of what made this all work for us. In addition to the selection process and those virtual meetings that we had together, that one-on-one coach that we had, that mentor, for me, it was Heidi at the beginning, like having those one-on-one relationships that also went into the bigger group, I think was extremely helpful as well. So you need, with that trust building, especially with it being virtual, having one-on-one connections and relationships as individuals as well as the whole cabinet was super important as well. And I don't know the back end of how you made the selection, but as I'm looking back, as I put my teacher lenses on, you can see with the end that you had in mind, how each step went into making sure that the vision that you all had for making an actual cabinet, all the little steps that were taken, you can see it on during the mess of it all, it was very smooth, but as we were living it, it didn't feel like, oh, this is where we're going to. But you absolutely, now looking back, I said, oh, okay, this is why we did it this way. Everything we all did together had a reason, and it went to building that cabinet. So
yeah, that cohesion and collaboration and trust. Yeah, I totally agree. And I was really impressed by how everybody stepped up and was vulnerable and really just wasn't afraid to to complain or ask hard questions or we had one member that we always, yeah, exactly, hold us accountable. We were like, we need all those people from the different perspectives. So you've got somebody who's quiet but is really thoughtful. You have somebody who's talking a lot and getting us to the point, and you have somebody who just says, hey, wait, we've done all this, I want to see action, like what's next. So we had all that. I'm going to pass it to Erin to see if you have anything to add about that. But I think, as Naila mentioned, yeah, the coaching, one-on-one mentor coaching, I think maybe that's something we just need to make sure to emphasize as well. So.
Yeah, nothing else to add. This is great. Thank you.
All right. Well, then we'll just keep going through the process, and I'm really going to count on Naila for a lot of this to think about, how this all worked. So why don't you, we'll just briefly go through this slide. Is that before we started, we worked on, what did we want to see out of this? What was the outcome? And so this slide basically is kind of the action steps of what we wanted the cabinet to actually do in this process. So the first one is connect. And, like I said, we had a goal of about 10 to 12. We ended up with 8 fantastic folks. Then there was the listening. And we also held feedback sessions and listening sessions in all of the communities, which were extremely helpful. And all this, of course, takes time. As I said, like it was a long and wonderful process, but it's not something you can do quickly. And then the next one was the inform. And so, taking those learnings and those listenings and then bringing them to the group and then to the department and to the policymakers. And then the idea was that do all that, and then that the policymakers will then incorporate those right questions and that lived expertise into their decision making and their policy making. So, all right, next slide, please, Jonathan. Thank you. So I'm just going to go through these quick, and then I'm going to see if you have anything to add, Naila. So I'm going to take a quick sip of water. All right, so some things that we believe are necessary for successful family engagement and leadership. So as Naila said, we're going to use that word intentional. There it is. Intentional focus on building trusting and collaborative relationships over time. Second one, recognizing, respecting, and understanding families' needs and unique experiences, as well as, and this is very important, historical, cultural, and linguistic assets. And last in this slide, embracing a philosophy of partnership where power and responsibility are shared or ceded. So we're talking about sharing the power that you already have or taking the power that you need to be at the table. And I think that's all super important and humbling experience, I think, for all of us to participate in. So Naila, I'm going to let you jump in there and see if you can elaborate on any of these in a personal way.
Absolutely. I'm going to touch on all three actually. So that intentional focus on building trusting, collaborative relationships over time. I'm a person who I'm like, we have to solve all the problems right now. But being put in a position where not only was it expected that we wouldn't solve all the problems, but it was a shared responsibility. So I felt like we had that time. Like as long as we're making progress, I can see the progress and know it's not going to solve the problems right in that quarterly meeting, but we are making progress and I can see something was super important. It was never time when we left a meeting where we were like, oh, we didn't accomplish anything. We were able to name things that were changing or in the process of changing because of the expertise that we given back to the state. Again, I think there has to be, when you're inviting lived experts who have not always been valued or validated, there has to be some kind of vehicle for their own personal development so that they can feel and know that this is truly a collaboration and you're not going to pull the rug under them. And I will be perfectly honest, I swear, every meeting, I was like, I went into it all. I probably took almost a year and several coaches meetings before I was like, no, this is really real. And so don't expect, again, especially for marginalized groups and people who often put themselves in positions to not be heard and to set themselves up for that rejection. Don't expect the trust right away. Again, it's almost a year. Always went in with good intentions, but I always in the back of my head was like, the shoe's going to drop. This isn't real. They don't really care. What we said isn't going to matter. But constantly proving that we were truly valued and we were collaborating and not just for their agenda, but we were moving our agenda forward was super important. Again, that recognizing, respecting, and understanding our needs and our unique experience as individuals and as a community was always a safe space that even simple stuff like I know that if my 3-year-old came in here right now and hopped on my lap, it happens and we move on. It wasn't, oh, that's not professional. It's not appropriate in this situation because that is part of my experience and I bring all of me and that is okay. It was super important that that was known and reiterated. And it was, again, our lives and our experience was our expertise. I like that, Dahi, I will try. was valued and not just tolerated. And finding the right people, and not as the cabinet members that are parents and caregivers, but the people who were are like liaisons to those power, to that power. Again, I'm not sure how you all were found, and I won't pretend to know. Hopefully, you will help other states figure that out. But you had really good people who truly believed that, and if they didn't, they faked it really well so that we were able to create what we needed to for our cabinet. And yeah, that philosophy of partnership is not just important for the members that you invite to the cabinet or that you interview, but for the people who start the cabinet. So, I can talk all day, Doc.
Yeah, thank you. I love all of that. I think there's a really important thing we've only barely touched on. I think when Erin introduced this and talked about build and the funding and the braided support, compensation for lived expertise is essential. And I think Naila and I we're going to remind each other to like make sure we say that multiple times. And that's about that, sustainable funding. You can't, like you said, Naila, like it took a while to realize that, no, this is for real. And this isn't just going to end next month. Or this isn't going to, that we had a plan. We had the capacity to do this as multi-years and to have that compensation be reliable and meaningful. And I think that's just really important, because if we're saying that you're experts and that you're on a cabinet, then the compensation should reflect that. And I think that's just super important.
And I'm sorry, can I just jump
go ahead.
in?
Yeah.
Because I said I was going. Thank you for bringing that up, because I'm a person, one of those people, I've done this work forever. I realize the importance of it, and I'm in a position where I can, like, I've been poor, I've been homeless. Like, if I don't get what I need financially to do the work, I still would do the work. However, that thinking about it now was also a really big part of me trusting that this was valued, because I've also been in places where, okay, they didn't lose anything by not listening to me. They just wasted my time. They still got their check mark. So that is, thank you for bringing that up and like bringing this to the forefront, because that compensation piece is not just, oh, here's some money to throw at you. It does help so that I can do the work. But more than anything, I knew that you respected and trusted my voice as an expert, and not, again, just as somebody, oh, I can check this box. So.
Totally agree. Before we go to the next slide, I've noticed there's a couple of questions. And so I'm just going to briefly touch on a couple of them. There's one that asked, can you share any missteps that you made while putting the group together? And so I would say the one thing that I felt like could have happened sooner was the co-design process. I mean, I think you needed that trust and you needed that, that establishing that collaboration and communication. But if in the dream world, co-design would have been from the very beginning, because it's kind of like what Naila said earlier about, having a plan and then asking people to come and give feedback, and not starting at the beginning with asking the right questions and having that input. So the co-design has been a sort of an iterative process. And I think I'm really pleased that it's come along, but maybe it could have started sooner. Not sure. And there's also a question about the one-on-one coaching, and I think we're going to get to that a little later in the presentation. So I will try to make sure we address that. Jonathan, let's go to the next slide. So just real quick, a few other things that we want to make sure people know. Removing barriers to participation. One of our members didn't have a laptop or a way to join our Zoom meetings, and so we were able to use some of our Pritzker funds to purchase that. So that's an example. We definitely wanted diverse family perspectives, which we got, and I think it was particularly great at the in-person gatherings, because Naila and others brought their kids. So you can't have a cabinet that's all about parents and caregivers and kids without having some kids. So that was really awesome. And then, as we said earlier, the compensation is really key. Professional development. And so we didn't do a ton of that, but we really, I I think that was as needed. And then the coaching, as Naila said, was a real key component, and that regular feedback, which became the co-design process. So Naila, do you want to just jump in and cover some of these things about, like, how often we met and participation with DCF and all that kind of stuff?
Actually, absolutely. So we met quarterly, virtually, and then we had one every year. We had a group in-person meeting. Stipends were provided for that, and transportation and mileage was reimbursed. I think I'm sorry, we're talking about the removing barriers and providing appropriate stipends and compensation. Yes, everything on this slide.
Well, so yeah, like, just, I mean,
So even when we were interviewed and part of the process of being onboarded, we were asked what might barriers be. No one assumed what the barriers would be. And during each interview process, that was talked about so that those things could be taken into consideration as we move forward with who was on the cabinet, so that those things wouldn't be a problem. I don't know how, but like, for me, it's pretty clear, but probably because I lived it. You ask before you start the work so that those won't be a problem. You don't wait until there's a problem and then decide, hey, well, maybe we should have thought about that. You ask the person what would be some barriers to you participating fully, and then they tell you, and you make sure that there's solutions in place before it ever becomes a problem. So that was the biggest thing. And again, the stipends and the compensation.
Thank you.
Super important.
We're got still more to cover and not a ton of time, so I'm putting a couple things directly into the chat about kind of a little bit of a summary of some of the the outside needs in terms of the backbone support, and then the inside needs in terms of what the parents and caregivers needed to be able to fully participate and engage. So I'm just tossing those in the chat for everyone to see there. And now I think we can jump to that next slide, and I'm going to pass it off to Erin to talk a little bit about the engagement continuum.
Yeah, a couple of pieces that I'm going to give folks context about. We've been talking about DCF in here. You'll hear the acronym DCF, the Wisconsin Department of Children and Families. And I want to just give a shout out because when we think about the engagement continuum, the Wisconsin Department of Children and Families has really been invested in thinking, what does the engagement process for our parents and caregivers look like? And they're actively asking, where parents do you want to be as part of the process of the cabinet? I think that's an important piece. And what parents of our cabinet have really talked about is, we really want to go towards this transformational space where there's two-way communication, there's this co-design happening of our agendas, of policies, and really just making it sharing some of the power at that space. And so I just wanted to give this example of this engagement continuum and really where it's headed, and a shout out to both our parents and caregivers, as well as the department for coming to this space collectively. I think it's just a really important piece that I wanted to mention. Both have been really engaged in that process of deciding how they want to move forward together. And so I also want us in the next slide to take a look at one of the pieces here. So we've talked about bringing folks together across the state of Wisconsin. And one of the other pieces that's really important is the work going back into community. So it's almost like an accordion. And there has been some great work that has been pushed up from community, right? Through community conversations, through so many different ways, and work that's come back and been pushed down to community. And it's been truly an honor to see this happen. And I would love for Naila to give an example of this in her home city in Beloit, to talk about really what that looked like and the impact that it had.
All right, so we here in Beloit have a Beloit Child Care Supply Action Plan. We are what you call a child care desert. There's not enough, it's not enough high quality, and it's unaffordable. And that has been a problem for our families for quite a while. And with our work with Build Kids Forward, like we were able to start asking the right questions. First of all, what is what is quality mean for us so that we can get more of what we actually want? And how do we need to be able to access that care? And we were able to hold community sessions, get feedback. We did surveys, we did lots of things so that I have my lived experience. We had another member, Drew, who had his lived experience with the child care systems. But more importantly, we were able to get the right people in the room who were also experiencing these issues to have a discussion and have conversations with other people who had money and power so that we could get some things moving forward for our community. One of the things that I've learned through this experience as we were identifying barriers and solutions, and as I was looking at our our action plan, I don't even know if it made it to officially into the action plan, but one of the issues we found was that the childcare that was available wasn't accessible for the parents who needed it because of our busing system. And so just by having the conversations with the right people in the room, we were able to get some things changed with our bus routes in order to, so that the little childcare that was available would be actually accessible. So I think like that co-design, being able to build this action plan based on what the people who needed the care were saying was super important. And then to see little things like that, like, oh, these people with this power in the room, they were actually listening to us. Again, that it really validated, formalized a lot of informal work that had already been going on. The plan is aligned and we were able to get this thing going. So, and I do believe there's a link to this. The action plan will be dropped, a link for the action plan. I'm not sure. I don't know. That's not my pay grade.
It's okay. Well, we can definitely drop it in, and I will just say this. One of the part of the secret sauce, I think, here in the secret sauce that we're working on is community public-private partnership and putting those pieces together, centering our community in this conversation. And it's just some of the values that at the state level cabinet that were really thought about at the local level. And I think the other piece to just mention that you really touched on, Naila, is we came in, right? People were focusing on childcare, but with our families, it wasn't just childcare. There were more pieces to it. You talked about transportation, right? Like the bus systems, the bus line and the routes and the times, they were
Right.
changed. And that impacted actually people being able to get to
The
childcare.
childcare
There
that
were
was there, yeah.
so many other pieces that weren't directly in childcare, but really adjacent to, that impacted children, families in the community. And so how do you, right?
I
How
was
do
gonna
you
say
develop?
things that nobody would have ever known if they had made this change or thought about these things without those community conversations.
That's right. And when you talked earlier, Naila, about solutions, that those in community know the issues and they know the solutions, this is the perfect example of that. That the solutions came directly from community. And I just want to say that this was a initiative that was done with a number of people, but again, centering families was critical, and it's critical in all this work that we're doing. Thank you. Okay. Let's see here. I think if we go down to the next slide, one of the pieces that we've really been talking about, but in many spaces, not only in Wisconsin, but also in other states, is community public-private partnerships, this concept here. And we've talked about this with parents and in this cabinet and in other spaces, but thinking about the opportunity for local state government, as well as our philanthropy, our advocacy organizations, to come together and really work centering our families, centering their needs, their ideas, their solutions right into this space. And I think there's just something very magical about about this. And so I just wanted to share that there is this like almost like reimagined way of doing work that's been talked about in a number of states and territories. And again, wanted to just show it there to have you just think about that and think about what that could look like. Knowing that families would be able to provide input in all of those spaces, that they could drive policy program funding decisions, between public and private. Really thinking about implementation strategies and solutions and how to implement, as well as thinking about ensuring those decisions and the implementation are meeting the needs of community. So just sharing an example of something for you all to think about as you continue to move forward in your journey. Okay, let's see here. Let's keep going. We'll take a look, and it looks like folks were just putting in the action plan here. This in the link in the chat box was the Beloit Child Care Supply Action Plan that has that Naila and I both referenced. Dahi, going to turn it over to you.
Thank you. I think we've been throwing a lot at these folks, but hopefully, you can, click on the links and then the best part of this whole project, and we really appreciate Build's support of this and creating these webinars that you could come to. But what we want to talk about now is that the Robert Wood Johnson Foundation has provided funding to both Kids Forward and the Wisconsin Early Child Association to provide free technical assistance to any states and communities that are interested in doing this kind of parent, caregiver, educator, family engagement in any way, shape, or form. So as part of this grant, we have the ability to answer your questions, to do one-on-one coaching, to just, if you reach out to us, we will respond. So it could be an email, a phone call, a meeting, sharing resources, iterative, you name it. So just want to give a big shout out to Robert Wood Johnson for that and for this collaboration with both WICA and Build and with Erin's group, All Children Thrive. And a huge shout out to Naila for joining us today to give a perspective of actually, one of the members of the cabinet and the work that they're doing down in Beloit. So at this point, I'm going to pass it on to Erin for the kind of closing. So
Naila, did you want to hop in? Go for it.
Yeah. Before you close, I saw a very a good question or comment regarding, I can't find it. It's the people, even though the people with the problems have the solutions, it's the people in power who need the solutions. I think if you don't walk away with anything but understanding, with a deep understanding and appreciation, is that the people have the solutions, and we mostly need you to give us the resources and get out of our way, or let us tell you what to do, and things would move so much faster. And this cabinet created a space for the people who are experiencing those things to tell the people in power, this is what we need, do this. And it'll be so much easier, so much more efficient if you just listen to the people. You have the resources, and I'm okay with that. This is what you need to do with them. And I just needed to say that, get that off my chest, because I saw that very.
Yeah, and I just reposted it in the chat so you could see it there that you were responding to, so everybody can know what you were talking about. So thank you.
Yes.
Awesome.
Naila, I love listening to you. So you could have the floor.
You can have the rest of the hour. Yeah.
Yeah, it is amazing. I just want to reiterate the fact that this is a true collaboration. I want to just give a shout out to our partners, Wisconsin Early Childhood Association, as well as Sankofa, Robert Wood Johnson Foundation with funding Kids Forward. And in this particular work, the Wisconsin Department of Children and Families, having been somebody inside government and now outside government, I talked about this earlier, that inside-outside government piece is really, really critical. Again, community, public, private partnership. that connection is critical in advancing policies, programs, decisions that meet the needs of children, families, and communities. And so I do want to talk on the next slide to just mention a few other things for you here. So to support Wisconsin in this technical assistance project funded through Robert Wood Johnson, Build is hosting 2 additional webinars. The next one is on August 14th from 2 to 3 p.m. Central Time. And this is an opportunity to hear from Wika and Sankofa on early educators and their voices, and really thinking about the co-designed research and how that has translated to systems change. So I wanted to mention that it's an important piece of the work that we're doing. And then on August 21st, same time, looking at advocacy efforts and what tools are needed to really drive equitable policy and systems change. So thinking about from both the parent, caregiver, educator, provider, all of those lenses. So I just wanted to mention those 2 opportunities, give a shout out to Build for hosting our webinar series. And a couple of other things I do want to mention is we ask that you please fill out the feedback survey for the webinar. It will appear in your browser once this webinar closes. So I wanted to mention that. And of course, really just mention as well the upcoming Build conference that is occurring in December. And so there's an opportunity to continue these conversations, learn more that's happening from other states, and just keep doing the good work that you all were doing. Again, I want to thank you all for being here. I want to thank Build, all of our partners. It's been a pleasure. And I do, as always, want to just give a shout out to Naila for joining us today. Thank you so much. It's been a pleasure.
You're
All
welcome.
right. Thank you all. Have
Thanks,
a great
everyone. Take
Thank
care.
you.